Newly announced price drops on 10 Medicare drugs could be just the start of more affordable prescriptions. The Biden administration says Medicare now has the power to negotiate such prices, not just this year, but in the years to come. To explain what this could mean for your health and your wallet, I'm talking with lead benefits counselor with Houston-Galveston Area Council, Alejandra Rischan. Good morning.
Good morning.
So we have been talking since the beginning of the Inflation Reduction Act, and slowly things have been rolled out as we expected them to. So tell us what the newest announcement means. What are the changes that people can expect to see?
We're really excited. So the new pricing has come out for those 10 medications, and now we're actually seeing the percentages that folks are actually going to save at the pharmacy. So we're seeing everywhere from 30+% for blood cancer medication all the way up to almost 80% of savings for folks at the pharmacy.
Yeah, I remember those blood cancer medications were a big one because those are really, really pricey and people's lives depend on it. But these 10 that were released yesterday, they're a lot more common. I remember like Jardiance was on the list. Unfortunately, I left my list over there. What are some of the common medications that people probably will recognize?
Yeah, so the big one that I see all the time where we get a lot of phone calls is a medication called Xarelto, which is a blood thinner. Jardiance, Januvia, and Entresto, so just to name a few of them. But they have medications for psoriasis and arthritis on there. There are medications for diabetes control, blood pressure. So we are very excited to see that rollout of savings next year.
Do we know how much they're going to cost? Like how much people could be saving now?
Yeah, so on Januvia in particular, just because that one has the almost 80% discount moving forward, we're looking at an out-of-pocket cost of about $113 for a 30-day supply, which is 80% cheaper than it has been. It was over $500.
Mm-hmm. How is this going to impact people now? I mean, is this just the beginning, these 10 drugs? Will there be more?
Yes. So what's supposed to happen is moving forward, they are supposed to continue to add medications to this list every year. So there will be an updated list that will come out next year for 2027. In addition to that, we will also see a $2,000 cap on all medications for 2025 for Medicare beneficiaries as well.
Mm-hmm. How is this going to impact people? So this is just for Medicare, by the way. This is just for people on Medicare, but the people who are enrolling in Medicare, which enrollment begins again in October, is this going to change anything with enrollment? Is there something that people need to know before they enroll?
Well, starting October 15th is when everyone is able to shop their plans for 2025. Unfortunately, we will not see the price difference for those 10 medications until 2026, so we still have a little bit of time to wait for those. But that $2,000 cap will go into effect next year. So folks that are paying over $2,000 a year right now in their medications will see that relief effective January.
So are we saying that people who have the Part D plan for prescriptions, anybody on Part D who was paying more than $2,000 for a medication, they won't have that starting in October?
Right. So there's different coverage levels within those prescription drug plans. Right now, the max out of pocket usually is about $3,500 a year for someone before they get into the catastrophic level of medications. So now they will see that relief down to $2,000.
Okay. Any other drugs that you expect to get lowered over the next?
Oh goodness, I have a laundry list of them, but I can't.
That you want to get
I mean,
things that you think that will actually be added.
Yeah, I wish I had a wish list of the medications, because really right now the 10 that are on this list are medications that we hear about constantly. So even just having those there, I'm excited to see that. I'm hopeful that more medications with brand names will be on that list moving forward.
Jardiance, there were diabetes medications on the list. One that is not on the list right now is Ozempic, and we know that people are paying a huge amount to get Ozempic. You know, the surge with weight loss just made that drug very unaffordable for some people. Could that be one that gets added to the list?
It could be. It could be. I mean, I think what's happening is that they asked for public comment, and they will have a list of those medications hopefully sometime mid-year next year for us to take a look at. But I mean, really, it could be any of the medications currently available, hopefully.
Okay, so where can people find more information? Because we did not put the list of the drugs on our
So the Centers for Medicare and Medicaid, CMS.gov, has a great list and just a great information breakdown of what the Inflation Reduction Act actually has done from 2023 all the way to the current level where we're at right now. So I would always recommend going to cms.gov as well as medicare.gov, because that will give you the up-to-date Medicare information at your disposal.
Yeah, and my apologies that we did not get that list up on the screen, so we'll be sure to put that on dohouston.com. There are 10 drugs that are now going to be available to you at a lower cost starting, you said, in 2026. But if for those of you on Medicare who are paying more than $2,000 for your prescriptions, this is good news for you starting
January.
Yes, starting ASAP. Alejandra Rischan, thank you so much again for coming in. We always appreciate hearing from you. Anything else that you want people to know?
Just be on the lookout for open enrollment October 15th. We'll be able to see exactly what those prices are going to look like with that $2,000 cap after October 1st. So we can't make any changes until October 15th, but please check your benefits every year. We want to make sure that you're getting the most bang for your buck on those drugs.
And remind people how they can contact you, because applying for enrolling in Medicare is very confusing for people, and you guys can help.
Yes, so I'm with the Houston-Galveston Area Agency on Aging. Unfortunately, we don't cover Harris County. The Harris County Area Agency on Aging does cover beneficiaries for Harris, but you can go to our website at h-gac.com/aging.
Very good. Thank you so much for coming in. We appreciate it.